to qualify for any sort of assistance in our county, and we flew just under the radar of CPS. We were victims of trauma trying to survive and were desperately in need of the resources that we didn't know that were available to us. I believe my family's personal experience helps in my ability to connect with the families on my caseload as a CPS worker, because I can genuinely relate to the hardships that many families in our county are facing. Health and Human Services face an uphill battle when servicing these families. Not only is there a systemic problem such as homelessness, poverty, and drugs, but there is also overly long wait lists for services due to a number of reasons, including a lack of experienced workers or the general lack of workers within these service organizations, CPS included. CPS faces chronic and ongoing staffing shortages. There's currently 30 CPS caseworker positions in Chautauqua County with 6 vacant positions, which equates to 20% of the CPS workforce. There are 2 teams based out of the Jamestown office with 8 caseworker positions on Team 1 and 10 caseworker positions on Team 2. Team 1 is at 87% capacity with 7 trained caseworkers and 1 vacancy. Team 2 has a 60% capacity with 6 caseworker positions and 4 vacancies. However, of those 6 filled positions, 1 caseworker is on medical leave and 1 caseworker is currently in training and is not receiving a caseload, leaving Team 2 with a 40% workforce. The teams that work out of the Mayville office is at 100% capacity with 6 caseworkers, and the team in the Dunkirk office has 6 caseworker positions and is at 83% capacity. 5 of those positions are currently filled, and there is 1 vacancy. On top of the staffing shortages, the Jamestown office is presented with the unique challenge of having 62% of the staff having under 2 years of field experience, while the Mayville and Dunkirk offices each have 16% of their trained staff with under 2 years field experience. Due to the ongoing staffing issues coupled with the limited number of caseworkers with experience over 2 years, caseworkers from the Jamestown office expressed to their supervisory staff and to the unit's administrative team that there is a need for a 40-hour work week to ensure that the families we are working with are receiving the time and attention they need as well as they deserve. On March 18th, caseworkers received an email stating that starting on Thursday, the 21st, we would only be able to work a 35-hour work week unless there was an emergency. The email did not contain any explanation for the sudden shift, and when the Jamestown-based CPS employees requested a follow-up meeting with Commissioner Hernandez, he declined to meet on this matter. In my opinion, this is an irresponsible decision. Oftentimes, caseworkers are seeing firsthand how poverty and drug use in the homes affect a child or children. Some caseworkers are seeing child fatalities, while others are listening to a child as they recall the sexual abuse that they've endured. There are cases which a child or children need to be emergently removed from their homes, which now leads to regulatory timelines with specific portions of that work that needs to be completed in that specific time. The administration's recent decision for a 35-hour work week does 3 things. First, it restricts the caseworker's ability to assess and assist the families on our caseloads that could result in needs not being met. Second, it undercuts the trust some of the caseworkers have in the administration and whether our work is truly being supported. And lastly, it tramples on the morale of caseworkers from an office that is already struggling. Thank you for your time.
Thank you. Is there anyone else for the privilege of the floor? And if you could try to keep it to 3 minutes.
That'll be the one.
Hello, good evening.
If you could state your name, please.
That's my first line.
Oh, okay.
My name is Melissa O'Connor, and I'm a CPS supervisor based out of the Jamestown office. I'm here following up on what Karen has said as well. I've been in CPS for my whole career with the county, and I am approaching 22 years in CPS. I'm coming to you on behalf of the Jamestown CPS staff, as well as the children and families that my workers serve in this county. I believe that some of you may have heard of the concerns that the Jamestown CPS staff has brought before the full legislature these last couple of months. We have addressed, we have addressed our concerns with the administration for well over a year now. I personally have met or been in meetings with the commissioner in April 2023, October of 2023, November of 2023, December of 2023, and twice in February of 2024. I've also met at least biweekly with my direct supervisor for well over a year to address these specific concerns as well. For approximately the last 3 years and for the majority of my last 22 years here, CPS staff, specifically South County CPS staff, have worked up to 40 hours each week due to factors of staff shortages, inexperience levels, extensive state training requirements, report intake levels, and the level of difficulty associated with reports in a more urban setting, such as gang affiliations, guns, violence, drugs, mental health, and general poverty. We currently have 6 vacancies out of a total of a CPS staff of 30 workers, with 5 of those vacancies in the South County. And this vacancy has been an ongoing problem for years. We are unable to recruit new workers nor retain the staff we have due to a variety of factors, including, but not limited to, having a 40-hour work week, which most people consider full-time, and we don't have it. Not enough pay associated with the kind of field work and stress levels this job entails, and I believe the morale associated with administration not prioritizing CPS in general. The caseworker civil service test was offered this past Saturday, and exactly 5 people showed up to take the exam. In comparison, back when I took the exam, there was almost 100 people in the room because the county was considered a great place to work. Both my direct supervisor as well as the commissioner have directly said to me in meetings and with staff that the former administration may have placed misconceptions in the minds of the legislature about CPS. And Commissioner Hernandez is the one who directly encouraged supervisors and staff to attend these legislative meetings and speak out on behalf of ourselves. It seems that since these workers have followed the advice of the commissioner, they are now being punished, which also serves to punish the children and families that we are working with in the community. A directive was given to the staff on Monday that a 35 work week is what is now required and to just do the best you can. This job is not able to be properly done in that amount of time, which when this factor was brought to administration, they agreed with us that it was true. Commissioner Hernandez is quoted in the recent newspaper article saying, quote, "I'll be honest with you, I don't think 35 hours is enough." The newspaper then reported that he said that the 35 hours are contractual, but he's able to renegotiate them, and he is trying to find the money in the department or from the state to cover the difference. That is actually true per the contract, as the contract states that a department head may increase the work week of their department from 35 hours to 37 and a half or 40 with the approval of the county executive. Additionally, 62% of the salary of a CPS titled employee is paid for by New York State, as this is a mandated position. So whether the staff is at 35 or 40 hours, the state percentage remains the same. The commissioner was also stated in the recent newspaper article saying that he recently had 3 applicants decline a position with CPS because it was only 35 hours a week and not 40. I've had more than that. When I personally met with the commissioner on February 15th, we talked about a 40-hour work week, and he stated that he could definitely make that happen. And then he met with the CPS staff in the South County about a week later and told them he could almost guarantee that he could make that happen. And now this response from administration after the recent newspaper articles is essentially to cut their hours and do the exact opposite of what was told. I cannot wrap my mind around this decision, nor have we received any true rationale behind it. I'm sure you can imagine how the staff feel about this: undervalued, unappreciated, and unheard. In addressing the difference between the North and South County during a recent conference with the commissioner and myself and another supervisor, he agreed that Jamestown area is more like the Bronx, referring to where he used to work in New York City, and the Dunkirk area was more like the suburban areas. He agreed that the Jamestown area cases have a higher level of difficulty and complexity due to the criminal activities, mental health factors, and poverty associated with a more urban environment, and therefore these take more time and logistics to fulfill casework needs, such as connecting with children who attend multiple different schools, even though they all live in the same house. The biggest concern for me personally, after 22 years doing this job, is this impact this strictly 35-hour work week will have on the most vulnerable families and children that CPS is mandated to try to help. It seems that this current administration does not share the same concern. Despite all of these multiple meetings over the past year, the information and data that has been shared over a very long period of time. The 40-hour workweek option for CPS would only need to be approved by the commissioner and the county executive. And to be clear, any current CPS staff who feels that they do not need the 40-hour workweek, it would be optional for them per our contract. Thank you for listening, and we hope that we can count on your support moving forward.
Thank you. Is there anyone else for the privilege of the floor? All right, seeing none, we will close that and go to our first proposed resolution, which is to amend the 2023 budget for year-end reconciliations, Department of Mental Hygiene and Social Services.
Hello, I'm Diana Songer, a Deputy Director of Finance for the Human Services, and we have a resolution to amend the 2023 budget.
Okay, if Sam could.
I'm sorry.
Right then.
Sorry,
Not Sam.
Sam Zafoto, Deputy Director of Finance. I am assigned to what's called the miscellaneous divisions, which is public safety, EMS, IT, county clerk, county executive's office, etc.
The resolution is to amend the budget for 2023 for some additional expense accruals that were posted in the state system for February of 2023, which result in increased appropriations, increased revenue, and also increase in the fund balance. This will be offset by that increased revenue, but it still leaves $168,594 fund balance increase.
Yeah, that's primarily driven through safety net, which is reimbursed at such a smaller percentage.
And the daycare is,
Yep. The daycare is basically covered through the block grant, which we do have funding basically through
Okay.
this year with the increased eligibility. It's more the safety net because we only get a 29% reimbursement on that.
and this is another request for the fund balance.
Yep.
We've already,
Yeah, we
done.
basically closed out the year last year, but with the state system, we knew we'd have the opportunity to see if there was anything left that got posted after last month's meeting that was related to 2023 activity. And these were the charges that were in the state system based on the BIC system that is used. So in talking to Jen, we, obviously should book this in the correct year.
okay, is there any questions? None? All right. All in favor? Aye. Okay, now we've got proposed resolution number 2, which is to authorize the lease agreement renewal with Warwick Plaza LLC for Chautauqua County Department of Mental Hygiene, mobile crisis team office space.
Marty.
Hi there,
Hello.
Christy Martin from the Chautauqua County Law Department. It looks like Mental Hygiene's mobile crisis team wishes to renew their lease with Warwick Plaza for the terms and the utilities as listed in the resolution.
Okay, do you know if this is the same rate as it has been?
I do not know.
All right. Any questions from the committee? Concerns?
Do we have any way of finding out if it's the same rate now, or do we have, like this? I don't know. Okay.
Don't know. Okay. Well, maybe we could find out for audit and control tomorrow.
Yes, I can find out for
Yeah.
tomorrow.
Okay. All in favor?
Aye.
Aye. All righty, thank you. Okay, that brings us to other.
believe we're other.
Yeah.
I asked Anna and Lacey and whoever else wanted to join us to come.
Lacey tonight. We actually decided we'd come and find out if the Human Services Committee has any ability to vote out all of the snow that we've been getting recently. We're hoping that was within, within your realm.
We'll vote on it. We'll vote on a Friday or Saturday.
Okay, all right. We'll
Next
see.
month.
Yeah, after April maybe. So I am Lacey Wilson, the Public Health Director.
And I'm Anna Powell. I'm our childhood lead poisoning prevention coordinator.
We are here at the request of Mr. Proctor to discuss or provide updates on the lead programming. If there's
Mhm.
anything specific that you'd like us to touch base on first. So there's many things we could talk about. Is there anything in particular?
Well, I know, and I guess I understand that you're going to be in front of audit control. I kind of wanted to do a little recap of what we did last August as far as the lead remediation program and the ARPA funds that were used and how that's working out.
Yeah, so we've had a few hiccups with ARPA funds, but all of that seems to be going smoothly now. And we anticipate getting those projects done this year.
And so, go ahead. Yeah, well, I was just going to say, and follow up to Anna. So Anna manages all of the lead grants and all of the lead funding through the health department. So the health department is tasked with a healthy housing, healthy homes, healthy communities type work through our public health law at the state level. And they've now at the state level rolled out quite a few rules and regulations and also law specifically around lead rental registries, which we'll come back and talk to you about at length at some point. So the state health department's really buckling down on lead. We are in an advantage in Chautauqua County that we have been working toward these systems and abating these problems for a number of years now. But it is at no small feat of Anna's to have collected all of these different grants with their very specific stipulations and the way you can use the money, and you can't use them all the same way, and you have to track all of that. So Anna's done that very well and making sure that that money gets spent appropriately and in the right ways. And then we had the opportunity, of course, to collect some of the ARPA funds, which is a major delight to departments and programs like Anna's, because that comes, very unattached in many ways, the ARPA funds do. But because it is so unattached, of course, the county wants to make sure that there's proper legal review of, how these contracts get put in place so that it's not used inappropriately. So, for Anna's purposes, it's hiccups for her because, here's this money. We want to get it out, resolve these problems immediately to, stop children from being poisoned with lead.
Correct.
But on the other side, we have to move through the legal and contract processes at the county level, which you all know if you work anything in government. It's a slow process, which we understand, but that just backs up our timelines in a lot of ways. So at this point, I think we have a strong legal team who's been on our side and helping us, kind of push it through and find the right ways to do this with, putting the county in the least amount of liability as we possibly can be. So I think we have a projected timeline of getting all of the ARPA funds spent by early next fall.
Yeah, I would think we would have all of the projects at least bid out by the end of the year and then be able to maybe finish them throughout the spring of next year at the latest.
And what that looks like now is the original plan was to bring on contractors directly with the county health department to do the work. With the advisement of legal, moved away from that option for liability purposes. And so now we'll be looking at working with community-based organizations who can contract with their own contractors that will be certified in the lead hazard programming through our department. So now we're just working on that process of contracting with that community-based organization. And they will then have to move through their bidding process of getting those projects bid out to the contractors that they work with.
And we already use that process through our HUD lead hazard control funds. So there really won't be any new steps to take with it. It's just going to kind of be another funding stream, but we'll do it in the same manner, same regulations that we follow all of our HUD regulations with. All of the contractors we've built through that program and that agency with our HUD program will be all the certified approved contractors we use for this project as well. So feel confident in getting that program finally
Finally got
done.
Yeah, Susan, sorry,
Yeah.
I had interrupted Susan.
I
Yeah.
wanted to ask just because, two things. One is, my understanding is that particularly in Jamestown, I was told that Jamestown has one of the highest lead levels in the state.
7th highest zip code in the state outside
Yeah,
of New York
that's-
City.
Yeah, zip code.
Right, zip code,
Yeah,
yeah.
yeah.
So can you tell us a little bit about that and how that is going to, and I mean, I got the impression there were two parts to that. One was determined by, I'm assuming, kids being tested positive for lead, and the other thing being the presence of lead in homes. Is that correct?
Right. So I would be very safe to say that probably 98.5% of all of our children poisoned in Chautauqua County is due to the homes that they live in
Mhm.
and the deterioration of the homes that they live in.
The age of the homes?
The age of
Absolutely.
The-
Yeah,
the
because
housing.
over 85% of our housing stock was built before 1978.
Mhm.
Right? So that was kind of like the cutoff at where consumer products said you can't put lead in paint anymore.
Yeah.
So being that, like I said, 85% of our homes in our county were built prior to that. So we have, and then, the older the home gets, so I don't have like exact numbers on me, but like built before 1960, it's an even higher percentage. Built before 1940, it's even a higher percentage after that.
Mhm.
And I mean, let's be realistic. Most of the homes built in Jamestown were built between 1900 and 1915 or something.
Yeah.
Like that's the, when we get an elevated kid and we pull that property up, that's the first thing we do is we look at the year and we look at the owner. And that year always sits right around those, that time. So, and because through the county, we haven't had any specific either legislation or laws or code that really revolves around lead-based paint, which would be wonderful. And many municipalities don't. But New York State has now passed in the public health law that there will now be a rental registry that is coming down on the local health departments. So we will be receiving funding, and our community of concern is obviously the 14701 zip code. And all rental units built before 1980, 2 units or more, will have to be tested for lead every 3 years. We will be getting a new system, a statewide data system that identifies the properties. I think our numbers right now that just came in with the contract paperwork they gave us, I can throw a little number. It's like a total of 5,067 properties every 3 years. So that's going to put us on an annual inspection rotation of about 1,600 and some properties to inspect every year.
That's a lot.
That is a lot. So that contract paperwork just went through. So I'm sure you guys will be seeing the resolution for that funding. And that, this is what works to prevent childhood lead poisoning. Rochester has had the same model for years. And they reduced their childhood lead poisoning rates by like 85%. this works. So we need community support. We need legislative support, through that whole process. Because it's going to be a really big lift to get compliance. And, but so that's the good news for.
Yeah. Well, and there is a lot of good news, and just
Yeah.
to highlight, just to follow up on that too. This group has been in particularly very supportive of the lead
Yeah.
programming work that we do. And I think because, Anna and her team has done a wonderful job educating leaders in our community and officials in our community, hearing about CPS and the different work there. I mean, the issue spans well beyond just an immediate, and specific health outcome for children. This is something that can be a lifelong, issue that creates, developmental concerns, behavioral concerns. A number of these children show up in other systems and intervention systems. So it is, it's a very good investment across the board for that reason. And I will say too, aside from the support that you all have offered, the city of Jamestown has really gotten on board as well. Because really the best way to approach this, the housing stock isn't just an issue for lead. It's an issue for air quality, soil quality, just safety in terms of injury and, mold, all the different things that come along with it. So the city of Jamestown has really come around to partnering with us as a department as well. They are building out some of their own code and zoning code and code enforcement and their own rental registry as well, because what you particularly see, and I think is important for you all to know as officials, as you're talking with constituents, that these ordinances are not coming down to as a negative or to prey on our local property owners who do a very fine job of keeping up their properties, taking care of them and renting them out. What we see across the board, and it's very unfortunate, but even outside of communities like ours, but when you have the kind of small town community USA where housing stock prices are very low, predatory landlords come in and they buy up swaths of property for very cheap. They live outside of the county, outside of the state, and many times in our case, outside of the country, like across the globe in Australia. And they really employ these predatory, rental style, models where they buy up these properties. They do nothing to improve them. They collect subsidized funds and they take them back to wherever they live and spend them there. So from an economic standpoint, it also makes sense, even just outside of the health economic standpoint, to do something about this. And so we're really glad that the state health department has gotten behind this. They're going to offer some support, some funding. You'll hear more from us about this, and we'll keep you updated about what Jamestown's doing too. We're making a concerted effort to stay in close contact and partnership with them so that what we do is in support of what they're doing, so that we're not working, in sideload ways, but we're also not duplicating services, so that this can be a really great endeavor for our community.
Say you have a child that has got lead in their system.
Mhm.
What triggers from that point to that house? Things happen quick when you have a child that's
So
positive lead?
here we can talk about how the lead team is a little understaffed as well, and I'll throw you through some of our a little bit of history and how our process works. So prior to 2019, we dealt with probably between 12 and 15 elevated kids a year due to the level being 15 at an action level, meaning that's when we're notified. That's when we have to go in and provide care coordination and environmental assessments. 2019, they dropped that level to 5. Our caseload increased to at least 85 children a year. We got one extra person. So where our team is really stellar and great is responding to those kids. So doctors put the levels in through whatever system they use. That system then talks with our system through the state called LeadWeb. And we have an ops assistant that manages that entire program. She checks those levels every day, matches kids with the state system. And if we have elevated kids, We are we have state timelines that the higher the kid is, the sooner we have to get in the house.
So what happens
Those
once you get in the
timelines are
house?
always met in far quicker than what they need to be. The issue comes with, we always have a revolving caseload coming in, and it's hard to keep up with all of the extra follow-up. We have to contact the families. We have to make sure the kids are being tested. We have to make sure the landlord's getting the work done. We have to make sure the landlord has the proper training to do the proper work, so they aren't poisoning the children further. So it takes a really big lift, not to just do 85 inspections a year, but to keep up with 85 kids a year. So that's where all of this funding really comes in, to be able to support homeowners that have elevated kids, and maybe they are just over that threshold of qualifying for a HUD program, because all of those have to be really low income families. So this funding that's more flexible for us really helps us get in there and identify these properties and helps the families out. So like I said, we're always responding to the kids in a timely manner. And that's pretty much how we get our data, is through those state systems. And then, if the phone number's wrong, we're sending somebody to knock on the door and say, hey, we're here from the health department. We need an updated phone number. So we're always making sure that we're really trying to keep in contact with our families.
And a pretty simple overview of how that happens is a technician or a sanitarian
Yeah.
from the team goes out, and depending on the severity of the case, we've also, I'm really, excited that we've been building on the partnership within our department, that a nurse will also go out to visit the family. So while the technicians are testing and swabbing surfaces all throughout the house to see where this lead might be coming from and to what extent, the nurse is working with the family to just provide support and to provide some technical assistance as to how they can move forward, some healthy things that they can do for the child, and just kind of be that support system for them. And then the technicians are able to take an inventory of what needs to be done. Anna's point of, what becomes difficult is the funding, because if you have to replace, a home that has 16 windows in it and you have to replace all 16 windows, I mean, who can afford that on a, tomorrow? If you have to replace doors and rehab stairs, I mean, that can be really expensive. We're finding on average, what is it, about $40,000 worth of work?
So our HUD grant that we applied for in 2020, that funding is coming up to lapse in July, and we're hoping for another funding round in that to get more money. But we anticipated that to be $12,000 per unit, and we're looking at $42,000 as an average cost.
Which you can imagine is what some of these homes sold for in like 1998. So I mean, you're basically repaying for the whole new home. So these, of course, tend to be families that are lower income. And then, of course, the other barrier there is the landlord and some of these predatory landlords that, why are they going to pay and respond to our request? I will say, too, I'd be remiss not to point out that Chautauqua County, for as heavy a burden as we have with the lead issue, Anna and Jessica, who's our environmental health director, they are gold standard implementers of these grants and these systems. So I've had the pleasure of learning that as I've been on state calls with the grant facilitators all throughout the state and even national level through HUD. The number of compliments that Chautauqua County gets for how expeditiously this work has happened, how well managed it is. And they refer most of the other counties who are starting this work to Anna and her team. So while that's a compliment, I'm like, stop bothering the staff that we need, they got to get out and do this work. But, so there's the hopeful message along with this too, that this work has been done, but we're just not going to stop until it's essentially completed and we don't have this issue in our community anymore. We have other things to combat that. This is an easy one.
I mean, and like Lacey said, you know, all of our programs we're you know, doing all of the things that we should be doing and implementing awesome you know, practices and best practices every day into our programs and making sure that we're doing the best possible thing for families. And I can't remember where I was going with that. Dang. I don't know.
Well, and I think,
But
are there any
it's
other
just,
questions?
it's gonna take, so we have the processes in place, but it's going to take a lot of time and a lot of money.
Yeah.
That's just the end game of it, is that it takes time and a lot of money. So if at any point there's leftover ARPA funds, you guys will know where to throw them.
It sounded like 700,000 was a lot of money, but
It's
if
not.
you divide it by 42,000.
It's
you know,
it's
Well, and
really
we have-
not. And I mean, I'm appreciative to have the opportunity to have some of those funds, because I know there was many, you know, many projects that probably didn't get funded. But this one is really important. You know, I mean, when we think of putting $700,000 back into our housing and communities, where, you know, every dollar that we put into preventing lead poisoning, we can see a return of $3, because we're not going to pay for special education. We're not going to pay for incarceration when these kids grow up and, you know, have legal issues because they're violent offenders, right? So that's what happens with lead poisoning. So when the more money we can throw at housing and preventing lead poisoning, we'll be able to see that economic return down the road. ×2, at least.
Yeah.
You were looking at doing 56 homes, I think it was, last August at $10,000 a piece. And then now you're saying the average is now 42,000.
Yeah. So with our ARPA funds, we're trying to be, because we're really narrowing our focus down on homes that are homeowner occupied, and they must already have elevated children in them. Right now, I have 50 files sitting on my desk, and we're working on going through and pretty much rating them. Like, who is the highest need of these 50 kids? Are these kids medically discharged already based on just education and things that we need to do? So we're really going to focus on, you know, rating these families from worst to least needy. I don't know how you do that, but
Yeah.
you know, we're going to base that off of blood lead levels, and obviously offer the funding to highest need first. And being that they're homeowners, most of them have already been through our lead safe work practice classes or taken our RRP class. And many of them can do some work themselves, like repainting surfaces. Where what they can't do is replace all the windows and doors in their house, right? So we're going to really focus on replacing those high friction impact surfaces, and then providing the the homeowners with the training and materials, paint, things like that they would need to do the rest of the kind of cosmetic work themselves. So I'm really hoping, because keep in mind that 42,000 average cost per unit is having contractors go in, replace everything, paint everything. They're spending, you know, there's a lot of labor hours when you have to repaint an entire house. So we're hoping that if we cut that portion out, we can at least get it down to $20,000 per unit. And I'm anticipating at least 25 units. Now, if we can get really creative and pair the money with our leftover HUD funds, I don't know, this is a pipe dream, but I'm trying to be very creative and financially responsible to obviously use what money we have through all of our grants to reach the most amount of people that we can. And that's always the goal. And that's what, when we go to reapply for a HUD grant, that's what they want to see. They want to see that we can stack funding sources. They want to see that we have some sort of financial responsibility to be able to make the most out of everybody's dollars. So that is what my time is mostly spent doing.
Now, this money's going to private homes.
Yes.
And homeowners.
Yes.
But on the rental side of things,
So rentals a little bit different. I'm not I've really seen a lot of homes with our HUD projects that, like, for example, we have a home in Dunkirk. They were eligible for HUD when they applied. But then we have to reassess their income every 6 months, right? So we go to reassess their income. They are seriously like $1,000 overqualified. Their house needs 16 windows. They're a perfect candidate for this funding, right? So it's really trying, like I said, to be creative where this money will be used where we can't use other funds. You know, families that are just over that income threshold or really don't have the mental capacity to go through the entire application process for HUD. We have a few of those families too. It's difficult for them to navigate systems and put in an application for anything, you know? So like I said, we're trying to be very fiscally responsible with it. These funds will all go to homeowner occupied units.
For the rental registry?
The rental
The
registry,
funds,
yeah.
so all of us who have worked with New York State, there's never been a fully funded mandate that they ever send down to us, but there is some funding that they're attaching to the rental registry. It remains to be seen. It's very much in the work group level of things now, assigning to what, extent that will be funded. But they have said that there will be funds available. Now, whether it's going to be funds to support workforce development, to ensure that the rental registry can happen, or whether those funds are going to be able to be used directly for rehabs on the homes remains to be seen.
I can actually clear that up a little bit.
Okay.
So New York State is funding the health department $601,300 for us to hire staff. And have equipment we need. We're going to need more XRFs if we're going to be doing this many inspections, right? So that is coming with that contract, and that will be a 5-year contract, and that will be allocated annually to us. Similar to our New York State CLIP funds, we get $366,800 annually.
So what is that though? Like the equivalent of like 1.5 full-time employees over 6 years, basically.
I think, like I said, I'm very crafty with our budgets and really making them work together. And I think it works because we can, we have different funding sources, even though they are small, but we can make them work together very efficiently. New York State also released a $20 million budget per year for these communities of concern, just for lead remediation. So that is another program that will be coming through for a resolution. It's issued through New York State Homes and Community Renewal. That is for like $486,000. I'm hoping eventually it's going to be annually. This first contract period, it's a pilot program. And we're just lucky enough to have already built these systems. So it's going to be very easy for us to spend this money. Many other communities, they aren't to the point where we're at with HUD funds and, the ability to stack funding and work with other programs. So it's going to be very easy for us to use that money but that is only for rental rental units. And, 85% of that budget has to go directly into unit production. So that's kind of the numbers that we're getting for the rental registry at this point. So there will be money directly for the health department to be able to implement this program. And then there is the homes and community renewal that they have tried to pair with that to actually help with remediation.
We probably have an advantage in that we have a higher, a disadvantage, but an advantage.
So
in
what
terms of
stinks
hierarchy
is
of-
that they don't look at the rate of lead poisoned kids, is they only look at your population.
We're a disadvantage.
That makes sense.
So that's that. I mean, good news, there's money there, right? Because like I said, it's going to take time. It's going to take money. So every single dollar that we can get to, fund this lift to prevent lead poisoning in Chautauqua County, we need time and we need more money. Always. Yes, Dan.
No question. A couple weeks ago, I asked you to come to the audit and control meeting to discuss this.
Do you
And
still
then-
need me to come tomorrow?
And then recently, Mr. Proctor asked you to do the same thing. So you can see that we do take it seriously.
Absolutely.
You don't need to come tomorrow.
Oh, okay.
So you can
Perfect.
save that. I'll just save you the time
Okay.
because it is important and I've learned the information we needed today. But I do have a
Okay.
question.
Yeah.
So, we did hear the concerns that you had for, needing funding
Yeah.
for this. And we acted by, designating some of those ARPA funds. One of my concerns is a lack of communication from maybe the previous administration in your department of, the funds have kind of been sitting around a little while.
Right.
So have we crossed those hurdles? I mean, was that a hurdle?
Absolutely. Yeah.
And
it's-
moving forward, we've corrected some of those.
So, yeah, and thank you, Dan, for pointing that out because that's something too that as I've come in, I've been able to kind of assess, how money is flowing through because human services, work very differently than like a DPF where DPF is like, hey, order the salt the year ahead of time. You kind of know what those budget lines are, which is why Sam, I don't know if he's here anymore, but we gave him a run for his money when he came over from DPF and it was so proficient. I mean, he did such an excellent job of picking it up because it is a very different ballgame in a lot of ways. Costs change. You're working with people. There's the social behavior aspect of all of these contracts and working with families. And so it can get a little chaotic. I think to your point, part of that, not only just, there's a change in administration, you have to really understand grant management, which is also a very specific ballgame. And there's timelines, there's deadlines, there's quarterly reports, there's claiming systems. They're all different types of claiming platforms and systems. Got to be in communication with our finance department, purchasing, RFPs. It's a huge ball of wax for all of that. So with that said, in that transition in leadership, I think a lot of that was kind of lost in translation in terms of where things were at, how things were happening. And once we got that part of it figured out, Anna then was on the ball and had $36,000 spent within like a month or 2 months, just on back ordered information and things that they already had in play. The other part of it too is just there is a lot of liability with what human services do. And so, the legal team has to wade through a lot of that too. So there is a lot of back and forth discussion that takes place in terms of, okay, here's our idea. Here's how it would best happen for us to get the services and the work done. Can we do it that way? And then we have to give them the time to also go back and say, all right, let's think about it. Let's talk about this. And then a lot of times they'll come back and say, you know what? It doesn't work right that way because of this, and this reason. Then we all have to go back to the drawing board. Okay, now what do we do? What can we do? Okay, let's talk about this. And then it goes back to legal. And so it's a long process with these liabilities built in when we're going into people's homes, when we're providing medical care.
And legal
Yes.
short-staffed.
Do you?
And legal,
yeah.
yes.
Do you,
And
Well, and I think that the biggest hiccup, right, was pretty much it being my project and my request, right? At the beginning of all the ARPA funds, we put in the requests. We were told, yes, this is, this is accepted as an ARPA project. But then we were never told we could start spending the money. So it wasn't until Dr. Folk and Lacey came in and, they're like, hey, what's going on with that ARPA project? I'm like, I was never told I could even start spending the money. So like, that was the hiccup, right? Now, these are normal things. We have to go through legal. We have to work with them. We have to do X, Y, and Z. But just
It's just the
rest
timeline of the
assured,
process.
like it'll still
Yeah.
be spent. I promise.
do you utilize an in-house law department, or do you utilize the counties? So you used to have. Are you lacking a position in health department for a lawyer currently, or no?
So I don't know how to answer that question because I don't really know how it was structured
Okay.
before. I mean, we have assigned through county, but
Right.
again, if you think about like just Anna's programs alone, how many grants do you have? An RFP. I mean, there's six
I
grants
think.
just in her program in one of our divisions. So, I mean, the amount of legal work, contracting work, finance, like fiscal work that
And this
is
isn't
done.
even getting into like, I'm going to feel awful for Christy. Like once we're to the point now where we have followed up with backlog cases for so long, like we're going to have to send landlords and start enforcing things, right? So I really want that legal process nice and buttoned up before this rental registry comes through, because a big part of that rental registry is going to be enforcement. So if we can only do six hearings on one day, I mean, I might fill that all up just for our lead programs. It has nothing to do with, our water and septic and everything else for the environmental health
Tobacco,
division.
yeah.
Yeah, tobacco. Yeah, I didn't even think about Atuba. So once we get into that, that's going to open up a whole nother can of worms and needing another legal person.
Do some of those funds that you've included hiring staff? Is
Yeah, well,
key
and
staff member could be.
So ultimately that funding is going to need to be technical staff to
Yeah.
be in the field doing the work. That funding will eat up our technical
Yeah.
staff that we need.
And they're pretty strict about that through like the state funding and state mandates, because they assume that because the enforcement comes through public health law, that there wouldn't be a tremendous amount of other layers of law that would need, legal that would occur at the county level, because we do have through state law the ability to enforce these through our Board of Health. There is a whole sanitary code. Mr. Proctor's going to be learning all about this. There's a whole sanitary code that very specifically and in detail lays out enforcement, fines, and the whole procedure of how to enforce. So I think that's kind of where the state comes from at it, where they say, well, we're not going to fund a legal thing because we've provided you all of the legal framework. Unfortunately.
Okay. Well, we better wrap it up. It's 5:58, so.
Okay, thank you guys so much.
Susan has one
I don't have
real
another
quick.
question, but I had another other.
Oh, okay.
Thank you.
All right,
We're good?
okay.
Thank you guys.
All right.
I won't see you in the morning then.
Yep.
I'll see that.
The other?
Okay, the other goes back to the CPS.
Okay.
You had said that there was a lot of information presented last month and I was not here last month, so I'm gonna watch that. But the questions that I have are about looking at the county, see if we can get information from the CPS department, whoever is the overseer. I don't know if that's John Anderson or if that's Carmelo or Diane Anderson, the sort of looking at the whole thing, the incidents, of cases, the types of cases, the difficulty, the personnel issues, as in how many people are not staffed and looking at that a little more in detail.
Okay.
But if you prefer, I can wait till next month to ask that. Is that,
Yeah,
what
we can do that.
is that what you would prefer?
Yeah,
Okay.
probably. Wait till, we'll see what we can do. Maybe get that. Maybe
And what's the
Before.
video of it? Because you might find a lot of your answers. watching the
Right,
video.
she said. that.
Right, I
Yeah.
already said that.
Yep,
Yes, I
yep.
understand it. Thank you.
Okay.
And I'm sorry, Mr. Chairman, really
Yeah.
quickly, I just wanted to let you know, somebody posed the question for resolution number 2, if it's the same rate as the 2023 rate, and the answer is yes.
Yes. Okay, good.
That,
All right,
that,
great.
that rent is the same.
Okay, great. Motion to adjourn?
Motion to adjourn.
Second? All in favor? Aye. We are adjourned. Thank you.
Yes. Yes.
Dedicated.
I wouldn't
You made it right. I
Yeah.
would have been like, I left Denver and now I came to Denver more, so was it even snowing out there?
Yes. We got there that day.
Yeah. Okay, thanks. I should have already.